Okay, so the third one talking about here is frequency of pain. And so intensity is what we talked about first, so how high the pain is. Now we're talking about how often you have it. And so people with sciatica, if they have high intensity and high frequency, then they're often wanting to pursue other measures such as medication and injections, all of these things that come with risk. And that if we want to help your body heal, it's good to know that we're healing and the signs and symptoms related to healing. And so that's why we have to talk about frequency. And so frequency is how often you have pain. So let me give you an example. When I treat patients and they're acutely in discomfort or just had something recently happen causing pain, they usually have high intensity and high frequency. Now, over time, as we're looking at the healing of it, we want to notice a reduction of each of those. And so sometimes in those patients, we may have high intensity pain, but we may notice a sign related to healing is that it's less often, and that, hey, I'm still having a lot of troubles bending over or sitting, and I'm having a lot of pain, but I'm noticing that it's not as frequent. I'm able to sit a little longer and have less pain, or I could do more of my day and not have as frequent discomfort, but when I do have it, it's still really intense. And so frequency is really important in that I always ask that question of like, hey, you may not feel like you're getting better. You may feel like things haven't gotten better over the last 2, 3, 4 weeks, but this is what I've noticed is that you're able to do more and you still have discomfort. And so as soon as you can get that little glimmer of hope that you're healing, things really start moving along and that you could do more and feel more confident in your movement and know that what you're going to do isn't going to flare you up. You may have discomfort, but it's not going to make you worse. That's a good place to be when it comes to sciatica. So frequency of discomfort is very, very important.